the report of this successful phase 3 trial in early Alzheimer's disease will change the landscape of Alzheimer's treatment in this country and worldwide. It will also change the landscape and the spectrum of studies that we will be doing to build upon this and come up with even better treatments or additional treatments. So I think it's a very key and remarkable success to have a drug that slows down Alzheimer's disease that's based on removing amyloid plaque from the brain. What's significant about it is that given at the doses it was given, in the fashion it was given, over the time period it was given, and to the people it was given, in this diverse population, it did manage to slow down the clinical progression. Functionally and cognitively, it seems they did better. And so that is a dramatic result, and we hope is the first step towards many drugs that we might use separately or together to try to improve the plight of people affected by this disease. I'm one of the investigators on this trial, so I supervise the activities at Columbia University in this trial that involved over 100 sites in the US and around the world. To this point, over the last couple of decades, since the 1990s actually, we have had drugs that are what we call symptomatic, that give people a little bit of a boost in their cognitive function. But they don't seem to, those drugs, they don't seem to affect the course of the disease. They don't affect the speed or progression. They just give people a boost whenever they're taking them. This new category of drug, lecanemab and perhaps others, does seem to actually slow the progression. So it's an enormously different concept and enormously more beneficial. It's one thing to have a drug that just gives you a little bit of a boost. It's another thing to have a drug that slows down the progress. We would be all very pleased to have a drug that reversed Alzheimer's disease and made people back to normal, but that does seem a little bit far off. We would even be very, very happy right now to have a drug that stopped it cold, and that even seems a little bit far off. But at the moment, we seem to have a drug, lecanemab, that seems to decrease the speed of progression. And I think that's an enormous advance in and of itself beyond the symptomatic medications that we've been using to date.